of the state and what we're doing to get more people vaccinated. Quickly on the numbers, what do I see here? I see we're continuing to do a lot of testing. Other states are falling off. Hospitalizations relatively stable. Deaths continue relatively stable. Positivity rate creeping up. And that's what we're going to talk about a little bit today. It's not my number one metric. I care more about hospitalizations, but I do care about the fact that, we've gone from 2.2% 7-day average, say 2-3 weeks ago, to about 3.7 today. So it's up by 50, 60%. I see that our friends in New Jersey are up at close to 8% as a 7-day moving average. And the greater Northeast in general is, I'm afraid, leading the country in many ways in terms of infections, in terms of some seasonality going on. And that's what we're going to discuss a little bit today. So the next chart is just a reminder to keep your guard up. And it looks a little bit like the chart maybe did in the spring, when you saw the virus coming up from the New York metro area. You see the reddest part of the state is down in southwest Connecticut. Probably the Valley has got some of the highest infection rates right now, Derby, Ansonia, Bethany. I do want you to know that when you see these cases per 100,000 and you look around the rest of the country and say, what's going on? I just want you to remember something Josh pointed out to me. We have 10 times as many people test per 100,000 as they do, say, in Mississippi. So it's tough to compare state to state because the differences in testing are dramatic. But it just gives you an idea of where the infections are right now, which we're watching closely. This next chart, I think, is a hopeful chart in this sense. You can see the decline in cases based upon age. And you can see that the purple line, if your eyes are really good, which mine are, 80 plus, has dropped the most, 70 to 79, 60 to 69. That's where the lowest percentages of infections are taking place. It's just a reminder that the vaccines are working. We saw that previously when we showed you what's going on in nursing homes over the last few months. This is a broader look across the population based on age. And, a little creep up, by the way, 20 to 29, 30 to 39. Those are the numbers you see in the, orange and the such. So that's where the infections are taking place. It's a younger demographic. Less complications, but perhaps a little less caution as well. Next chart. How are we doing on the vaccines? I think we're doing okay. We've got 80% of our folks 75 and above. That's if we can get 80% of all of our population, we'll be doing pretty well. 38% of all of our adults 16 and above have now received their first dose. 38%. And that's ramping up. We did about 150,000 this past week. We'll be doing 200,000 doses, 200,000 vaccinations next week, which means gives us a little bit of flexibility as we aggressively go vaccinate people. Pfizer is picking up a little bit. Johnson & Johnson is picking up quite a bit. Next chart. Because of the accelerating ability to get people vaccinated, we're getting people vaccinated at a higher percentage, and more importantly, we're getting a lot more vaccines. Just a little chart that we sometimes enjoy. The percent of our population who have been given their first dose. The national average is 25.7. The champion, New Mexico, Alaska, Connecticut, South Dakota, Massachusetts. It makes a big difference. That represents tens of thousands of people who have been vaccinated, who are safe, and that's reflected in lower complications and fatalities. So what that means is with more vaccinations, more vaccines, more people getting vaccinated, we had originally thought April 5th would be a day that we could open the door, open the aperture for everybody, regardless of age, to be able to make their appointment for a vaccine. We're going to move that forward a few days to April 1st. That's in 1 week. That means that starting April 1st in 1 week, everybody will be able to make that appointment. Again, it's going to be a rush at the gate. We understand that. But we're finding we had a fair number of doses available on our appointment schedule, as days went on. And I know that many of you still in the 45 and above age group still looking for that vaccination. 200,000 more appointments next week. Check frequently because every day we get new doses, new appointments open up. And that'll be a very important opportunity. The age-based system that Connecticut and a few other states have prioritized are making a difference. And they're making a difference in terms of saving lives, which is one of our number one priorities, is our number one priority. And I think one of the reasons is because we're fairly strict about it. There were less people and running, less ability for others to jump ahead of those that are older than them. And you can see Connecticut is the yellow line on this chart. And you can see the yellow line, if 100 is the baseline, let's say we're all at the same on January 3rd, we have gone down by probably 75, 85% in terms of our fatalities against that baseline. You can see for other states, it's been very different because they've had different prioritizations. They've prioritized different groups. They haven't been focused quite on the most vulnerable, which are those 75 and above, then 65 and above. New York probably has they've gone down by about half if we've gone down by about 80 or 90%. Not to pick on any state per se, but it just shows you, I think, the age-based system worked pretty well. I know Paul Hughes is going to ask me, what does that line for Rhode Island mean? And I can't tell you. I think sometimes the data comes in, it's very erratic. Rhode Island's the red line. You see it spiked up on February 21st, then went way down. A lot of the information we're getting is erratic, but the rest of those numbers, I think, are very consistent and should give you some confidence that because we've had a higher percentage of our seniors vaccinated in just about any state, that's making a real difference in terms of reducing fatalities. Finally, we're going to continue to do everything we can to make sure that the folks who are most vulnerable get vaccinated. And this is going to be becoming increasingly important as J&J and others ramp up the amount of vaccines that are available to us. Pretty soon, supply will hit demand. And at that point, we've really got to go out there and do everything we can to convince your friends to get vaccinated. So we put together a $58 million budget to go out and do everything we can to encourage people to get vaccinated. That starts with telephoning and door-to-door canvassing and using trusted advocates and using ministers at the churches, doing everything we can to make it easier to bring the vaccine to you, bring the mobile vans to you. And so you're going to see a ramped-up effort over the course of the next few weeks in order to do that. And I've got two friends here who can help us describe some of our efforts and what they're seeing. First, as I said, was Kathy Szilard. I was there with Kathy in Stanford Hospital. I think it was a few weeks ago. They introduced their program, No Barriers. Stanford's done an extraordinary job of not only getting a lot of people vaccinated, but getting those most at risk vaccinated. And Kathy, more broadly, I'd love to hear what you're seeing, how the infections have changed over the last few weeks, what we might expect.
Sure. Thank you, Governor, for having me. So our test positivity rate in Stanford was 3.2% this week. We were definitely seeing it come down, but not where we need it to be. Hospitalizations are also coming down. We have 19 inpatients today and only 2 in the ICU. So patients are a lot less critically ill, and that's on a basis of about 270 patients in-house today. We're seeing exactly what you're talking about, that the median age for COVID-19 patients has come down, and that's because of the vaccine, because of social distancing, good safety measures that have been in place, and that's all positive news. But I'm always reminded when I walk through the ICU, this is not over, and we have to stay vigilant on everything that we're doing. To date, we've taken care of 1,300 inpatients, and we've tested 190,000 individuals. I'm really proud of how Connecticut has fared during this pandemic, and particularly around the vaccine. In Stamford, 21% of our citizens have actually received the first dose of the vaccine, and today we achieved the lofty goal of having delivered 60,000 doses in our city, and I saw this as my moral and ethical responsibility to our community, and we have moved quickly and swiftly to do so. We also did something I think a little unique in that we decided to partner with the city of Stamford instead of operating parallel clinics to distribute vaccine. We worked together, and that has helped a lot. And on the 15th of the month, we opened up a second mega site, and Building Land Technology helped us to do that. And we are going gangbusters. We actually delivered 11,000 doses last week, and we're hiring 50 more people to up that number next week. 65% of our staff have been vaccinated, and we continue to work on that. Governor, you spoke about the No Barriers program, and that's one where we saw early on how these vulnerable populations, particularly the Black and Latinx communities, were so impacted. And so working with the Vida Health and Wellness Initiative and the high-risk, the COVID-19 high-risk community outreach task force, we did outreach to the community through this event. And what the No Barriers program is that we hold special clinics for the individuals in those groups where they come in and they get the vaccine, and there are no questions asked. We do ask for identification. If they don't have it, we still provide the vaccine, and we want to make sure that we're getting the penetration to that community. We're doing one every single week, and we have now vaccinated over 1,300 individuals. And I would mention that it is so important for the No Barriers program that we work with the trusted partners in our community, like Building One Community, like the NAACP, the churches, those dedicated groups that have the trust relationship with those individuals so they can help us open the doors and build the trust around getting the vaccine. I'm really happy to tell you that we have some new news in that the Alexandra and Stephen Cohen Foundation have given us a grant to do community outreach, going door to door to get the word out in those communities about how reliable and safe the vaccine is and how it's easy for them to get it. And we would not be able to execute the program without, I said, those partners, Dr. Tabitha Fort, Cecilia DeRosa, and the Jackie Robinson Foundation. AmeriCares also, and Charter Oak Communities, and we will stay vigilant on that. I also just want to remind people to come back for care. I'm very concerned when I look at the trends across our nation about people neglecting heart care, cancer care, postponing seeing their primary care physician. One of our doctors told me about 2 advanced cancers that he diagnosed last week in patients that should have been seen over a year ago in the primary care practice. So like every other hospital across our state, we have great safety measures in place, and we want to make sure people continue to care for themselves while we battle this pandemic.
Beautiful, Kathy. Thank you. And Kathy mentioned trusted advocates are the best people to convince others to get vaccinated. Jerry Reyes is chairman of the Black and Puerto Rican Caucus. You've done yeoman's work in Waterbury. Tell us what you're seeing and how we can help.
Thank you very much, Governor, for having me. And the city of Waterbury is what I consider one of the leaders in the state of Connecticut, and when it's come to citywide coverage and especially addressing communities of color. I've had the opportunity to speak with Commissioner Gifford and her team, and when we first started this conversation, we were a little lacking in communities of color, and I have to compliment the Commissioner and the Department of Public Health for Commissioner of Health for actually writing that correcting that action, if you will. I believe that recently, with the recent activities, when we've actually gone into the inner cities, in the recreation centers, into the different churches, different faith-based organizations, we have done a tremendous job of actually going into the inner city. And we're looking at the coverage gap where the commissioner presented to us a couple nights ago, 54% Caucasian, 38% African-American, and 37% Hispanic, which is a great increase over when we first started quite some time ago. I have to tell you that the Waterbury Hospital and St. Mary's Hospital and so many of the providers have been doing an excellent job in conjunction with the city of Waterbury. One that I'm very familiar with is the local Hispanic coalition in the south end of Waterbury that's been vaccinating our aging population. We started out with our seniors, and then we went on to those that were 65 and older, and now 55 and over. And we're really making inroads. It just goes to show you that familiarity breeds comfort, and comfort will allow people that even were hesitant to take the shot to actually take it. And I have to say that the BPRC has been very respondent when it came to supporting and advocating for communities of color to get the shots. And our challenge to every BPRC member was, when you were eligible, to make sure you got your shot. And as they get the shot, we post it on our webpage and on our social media pages. So the reason being that we're trying to do is actually advocate and show people it's safe. You can get it. You can trust it. If you see trusted leaders getting it, you can get it. You will trust and go and get it yourself. I am very happy with the work that's been done in the city of Waterbury, and I would be remiss if I didn't thank Mayor O'Leary and one of the main organizers, Mr. Adam Wrinkle, who started out with the COVID-19 tested and then quickly went into the vaccination as soon as they became eligible. We need to make more continuing inroads, and I was happy to hear from the commissioner last night speaking about next steps, more inroads into the inner cities. And then the next step is actually maybe even getting vans out and getting people door to door, and actually coming out with people that are going to canvass the neighborhood and get those. If we get 80% of the state, as you said, Governor, then these folks can go out and get the last 20%. A lot of this reminds me so much of the census work. But I have to be complimentary of the commissioner and her work. And also, Governor Lamont, you for your leadership, sir. Thank you.
Hey, thanks, Jerry and Kathy, and Josh and Paul are here. Any questions?
News 8.
Good afternoon. Governor, you announced the change in now allowing the 16-year-olds and up to be vaccinated April 1st, so a 4-day change there. How much of that has to do with, you mentioned the younger demographic now getting COVID? How much is that hospitalizations and a couple of things combined?
I think we're moving it up because the vaccination supply continues to ramp up, in particular J&J, 200,000 more vaccines, 200,000 more appointments next week. That allows us to get through the 45 to 54-year-old age group pretty quickly. And it's also a matter of what the take rate is. You'll see great differences between different towns, the percentage of people that are getting vaccinated. So we want to make sure that we keep that supply going and there's no vaccines left on the shelf. We've been pretty good at that.
So in addition to the supply being available, if you start at the top and see 75 and up, 80% vaccinated, is it kind of a trickle-down effect that enables you to move up 16 and older by a little bit?
Well, the other thing is in the younger age groups, 16 and above, many of them have already been vaccinated, just like we found many of the 45 and above have been vaccinated. So that narrowed the size of the cohort a little bit, allowed us to accelerate things.
Fox 61.
Excuse me. Hi, Governor. Quickly following up on your last answer, you mentioned that the group 16 and older, a lot of them have been vaccinated already. Do you have a current estimate of how many people will be eligible that have not been vaccinated come next Thursday?
Do you have that, Josh?
Yes. So in terms of the total population of people in Connecticut between the ages of 16 and 44, it's about 1.3 million. But as we do the analysis, and we've shared this on past phase changes a couple of times, we plan for that initial rush to be about 60%. So call that a little less than 800,000 people. And as the governor just mentioned, as we sit here today, we already have 182,000 people in that group who've already been vaccinated because they work in a healthcare setting or they're an educator, have gone in a prior phase. So by the time, we get to that phase next week, we'll probably be around 200,000 people there. So we're looking at about 600,000 people, roughly, maybe less, who will be, looking to get appointments a week from today when we get started. So as always, we'll have to ask people to be a little patient at the beginning of a new phase. We won't have 600,000 appointments available day one, but with 200,000 doses coming in a week, you can do the math and understand quickly that we'll be in a position in a relatively short period of time, probably before the end of April, where everyone in this state who wants to get a vaccine will have the ability to get one.
Thank you. And then, Governor, could you also comment on some of the pushback we're seeing from the GOP in regards to the extension of your emergency powers? And could you also comment on, specifically, we have heard before that in order to receive FEMA aid, you declaring a state of emergency, that is one of the key indicators to FEMA.
A key requirement of FEMA that we be in that state of emergency, which we are. I mean, we've just described the fact that our infections are no longer going down. They plateaued, in fact, creeping up a little bit. We're not out of this yet. And you heard Josh say we're putting our foot to the metal right now, pedal to the metal, doing everything we can to get more people vaccinated. We have to be able to move quickly in order to get that done. So I don't think this is any time for us to take our eye off the ball. We're doing everything, we can to save lives. That said, we're working closely with the legislative leadership, and if there are any particular executive orders they feel very strongly about, let's talk about it.
And then with a 30-day extension with your executive powers, do you know which executive orders you would definitely be extending?
Yeah, the ones of most importance are those specifically related to public health, those that allow us to turn that parking lot into a mobile vaccination center, those that allow us to make sure pharmacists can continue to give you a jab, a shot in the arm, and can continue there. I mean, I think those are the type of priorities that we have going forward. We need to be able to sometimes make moves when it comes to purchasing things on relatively short notice as well. But again, we're going to narrow that group of EOs over the course of the next couple of weeks, do that in association with the legislature, and hopefully they give us the green light to continue protecting people as best we can.
Thank you.
Channel 3 Eyewitness News.
Yes, Governor, when the rollout expands on April 1st, will there be a prioritization for those with comorbidities? We've been hearing about the possibility of accelerated access for this population, and just wanted to see if anything was in the works.
Things are in the works. Josh has had exhaustive conversations with our hospital leaders, how they want to prioritize that. We're going to roll out some of their best recommendations on Monday. Anything to add to that, Josh or Kathy?
No, that's right, Governor. More details to come on Monday. That is still part of the plan. In addition, we're in the planning process for some dedicated clinics for people with intellectual and developmental disabilities that our team at DSS, Commissioner Sheff, are working to plan that you'll see starting to spin up towards the end of next week as well.
Yeah, we're working in collaboration to identify with the at-risk groups and how we'll prioritize them.
Got it. Specifically regarding the 16 and 17-year-olds, we know that the Pfizer dose is the only one that is approved for those two ages. Do you expect a rush on those doses, or is there going to be an increase in shipments when it comes to the Pfizer vaccine?
Want that, Josh?
It's a great question, Matt. Yes, so the good news is we are getting a lot more Pfizer starting next week, and we do expect Pfizer to continue to increase. That said, we talked earlier about patience at the beginning of a new phase, and we know that the 16s and 17-year-olds and really all the kind of people in their young 20s, they don't have a comorbidity. They're extremely low risk. And so that's a particular group that we're going to ask to, maybe not rush in the first couple of days there to try to book appointments. We're not going to be setting up dedicated clinics in the first days for high schools or colleges, for example. But as we get later in the month into April, into May, we will look to provide, more dedicated access, particularly as we get more Pfizer. We're also going to add a filter to the vaccination finder on our website for people who are 16 and 17 to filter just for clinics that are providing Pfizer vaccine, because that will be a key requirement.
And my final one on this, for the 16 and 17-year-olds, will they need to have a parent or guardian present for the vaccine?
It's likely that that's the case, and our team at the Department of Public Health is working through with our providers, what consents may be required.
Thank you all.
NBC Connecticut.
Good afternoon, Governor Matt Austin with NBC Connecticut. Just talking about the positivity rate first. I know we've been watching it track up a little bit, and you mentioned seasonality. Is the hope as more people become vaccinated and we head into warmer days and into the spring and summer that potentially the positivity rate might come down?
Yeah, I think so, Matt. But I do watch it. I mean, we have probably close to 40-50% of our people have either had their first vaccination or previously infected and have some antibodies. And yet you still see this creeping up, again, a narrow band of younger people. I think maybe we've relaxed our guard a little bit. Maybe some people came back from Florida or out of state, coming back from vacation. But I'd like to think that as we move into the next month, it's warmer, we're more likely to be outside, a lot more likely to be vaccinated.
And in terms of the April 1st eligibility date, I know there's a lot of people really ready to, jump the gun and get that going. Can they do anything in advance of that in terms of on VAMs? Can they pre-register? Is there anything that they can do to get a little bit ahead of things?
Next Thursday, if you're in that age group, 16 to 45, as Josh said, please don't rush the gate, everybody at the same time, but that's the day you can do it. I'd say for the next week, we have 200,000 more vaccines coming. So, 45 to 54, here's your opportunity.
And finally, I know you were talking a little bit on NPR yesterday about this possible, vaccine passport. Can you just talk a little bit more about that and why you think, the private sector should be more leading that as opposed to the state?
I think, first of all, Matt, we're going to do everything we can to get people vaccinated. I don't think talking about the passport when not everybody has had an opportunity to get vaccinated seems very fair. That said, we've had some conversations as fellow governors in Washington in terms of what will happen in May, June, and July. And I've heard a lot of folks from the private sector say, look, I want to be able to say my restaurant has got a vaccination-only area here to make people feel safer. I've heard folks from the cruise line say, because they were hit really hard a year ago, they'd like to have a vaccination-only ship. There's some push and pull and civil liberties issues in and around that, but I think those are the type of discussions we're hearing right now. My instinct is the government doesn't want this to be a government mandate or a government database, but they are sort of interested in seeing how the private sector wants to work through it, just to give consumers confidence that they can come back in safely.
Okay, thank you.
Thanks, Matt.
News 12 Connecticut. The Associated Press.
Thank you. Good afternoon, everyone. Governor, with this decision to allow people 16 and older to make appointments on April 1st, does this mean that there are slots that aren't getting filled now? And if so, where is this happening and why is it happening? And I wonder if maybe Ms. Szilard could talk about whether or not she's seeing unfilled slots.
I'll start and then hand it over to you, Kathy. I don't think there are any unfilled slots. What we know is that they're not filling up as rapid as they were a week ago. But remember, a week ago, they all filled up in about an hour on that first day. Now there's more time, and so that gives us an idea. There's a little bit of lag in the system. We found out from the other age groups that once you get up north of 40%, you probably start having some lax there. So I think this is the time for us to move forward on April 1st.
Yes, I would agree. We have no unfilled slots. We release slots as we have vaccine available, and we know there's a reliability around the delivery of the vaccine as well as the availability of the second dose for the Moderna and Pfizer. But however, as the governor said, we want to accelerate the pace with which we get everyone vaccinated. And so looking ahead to the upcoming weeks, we will open those slots and get people in as we have the vaccine available and get the next group of ages vaccinated. And we do need to let the healthy 16 to 20 some odd year olds hold back a little bit. So we get those in the a little bit older and those with comorbidities vaccinated as quickly as possible.
And Sue, if I could just add, I think the key point is not, are there appointments going unfilled today? It's when is the day when there would be unfilled slots. And so when we do our analytics and we forecast it out, that's what gave us the confidence to move the date in from April 5th to the 1st. And what gave us the confidence to move the date in originally from May 3rd all the way up to April 5th and now to April 1st. So we're forecasting out to where that point's likely to be. And that's what gave us the confidence to move it in further.
Okay, great. That explains it. And also, Governor, you said that we are continuing to do a lot of testing. I was actually at a drive-up testing site today where one of the nurses told me that things were really slow, and except for people who need to get tested before a medical procedure, a pre-op test, they would be dead up there. Is that a diverse enough group of people that should be tested? Is that really giving us a real picture of what's going on?
Yeah, excellent question, Sue. Look, we still did 38,000 tests yesterday. That's down a little bit from the peak, say, a couple of months ago when people were a little more on edge and much more eager to get tested. But compared to what you see in some other states where the testing has fallen off, I think 38,000 or 200,000 plus every week is still giving us a pretty good broad insight into what's going on in terms of community spread.
But if it's just pre-op people, I just wonder if that's a big enough sampling.
It's not pre-op people. I mean, that may have been what that individual said, but we have, as the governor said, we have far more people getting tested than just that.
Okay. All right, great. Thank you very much.
Hearst, Connecticut Media.
Thanks. This is Julia Bergman. Governor, I understand the CDC is not asking states to track cases of the two variants of concern identified in California. Besides the numbers that were put out previously, is Connecticut tracking those two variants? And if so, do we know what percentage of our cases they might make up?
We are tracking. It's not a complete track, but the B117, aka the UK variant, which is highly infectious, looks like it could be about 40% of our infections right now. Maybe a little more in some of the states just to the south of us.
Yeah, and for the two you asked about the two the B1427 and the B1429, the two from California. Our partners are screening for those, and so far identified a very small number, 2 of the B1427 and 7 of the B1429. So it's a very small percentage as compared to what the governor just said. The B117 we're up to 379 cases identified of that variant at this point.
Thanks. And then another question. You mentioned that the cases are creeping up among the younger demographics. Do you see that continuing with hospitalizations and deaths among that population? We're already seeing hospitalizations increase in Connecticut in the younger groups, according to the CDC.
I mean, Kathy, you were saying in that younger population, maybe there's still some hospitalizations, but not nearly the demand on ICUs. But what do you see?
Amount of hospitalizations. Those age groups tend to do much better. As you know, with COVID-19, occasionally they may need to come in for some hydration and support, but that is not who we're seeing critically ill. We're seeing those with a lot of comorbidities and in higher age groups are the ones that are critically ill.
And then the $58 million for the equity, is that federal stimulus money, or where is that money coming from?
Yeah, most of that's federal money.
Yes, those are cooperative agreements with the CDC that our team at the Department of Public Health is responsible for helping to prioritize and administer.
And then last question, a little bit unrelated, the House is voting to extend outdoor dining through March 2022. Governor, do you agree with that decision?
I sure do. I think it's bringing our towns to life, safer to be outside. I love it.
And I'll also add just an example of them codifying one of the governor's executive orders. So it looks like that the legislature is up and running. And so we look forward to that bill getting to the governor's desk.
The Connecticut Mirror.
Thanks, Max. Hey, Kathy, Dave Altamari. I wanted to ask, you said about 65% of your staff had been vaccinated. Do you have that number for your minority populations, your African American and Hispanic population?
We do. We know I don't have the exact numbers at top of mind, but we do track that. The three groups that we're seeing reticence in is women of childbearing age or someone who is thinking about getting pregnant or is pregnant. And we do see that in the Black population and some of our Haitian employees that there is some reluctance. And we're doing a lot of work peer-to-peer. And every hospital across the state is doing the exact work, same work, to have our professionals meet with these individuals, to talk to them about how safe the vaccine is, and then have that peer-to-peer conversation, because those are the individuals who will have the most impact. And we're moving every week. That number is getting better and better.
Do you have any sense at all? I mean, I know talking to other hospital systems, their numbers are between 30 and 40% of their African American staff that's been vaccinated.
That would be close, yes.
Are you in that range?
Yes, we are in that range. But also, again, the young women of childbearing age that are concerned. That's the other group.
Okay, thanks. Josh, I apologize if I missed this. My eyes aren't quite as good as the governor's, but the percentage of 55 and over that have been vaccinated and the percentage of 45 and over, do you have those numbers? I don't think they were on the graph.
Sure. 55 and above, we're up to 69% of the population's been vaccinated, and 45 and above, we're at 57% of the population's been vaccinated.
Okay. So you're actually, theoretically, the 55 and above, you're going to be above the number, you're doing a little better than the number you had first shot for, right? Or 70% is a pretty good number, I think.
Thanks. I think we agree, but we still have work to go. We want to get that as close to 100% as we can.
And do you have a breakdown on the 200,000 doses coming next week? Is the Johnson & Johnson, I'll take Paul's question here. Is the Johnson & Johnson ramping up next week? I suspect we're going to get a lot of that very soon.
It is. We don't have the complete breakdown for all of the different channels through which providers in the state get vaccine at this point, but we do know that there will be a significant increase in Johnson & Johnson next week. We already have eyes on over 37,000 doses coming in next week, and we expect that number to go up further once we hear from all channels.
And this is my last question. Are the pharmacies getting more vaccine from the feds? Is that increasing?
Yes, they are as well. They're seeing also a significant increase next week.
And do you have any data, any sense of who they're vaccinating? Do you get that? I mean, I know with the nursing homes, it was hard to get some of that data because it was all through the feds. Are you getting data on who the pharmacies are vaccinating?
They like all providers have to report who they're vaccinating to the State Department of Public Health and our immunization database. One of the key things that they are participating in is our equity goal to make sure that we're vaccinating in those high SBI zip codes at the same rate relative to the number of people who live in those zip codes. And we have more work to do there. That channel in particular is lagging. And so, we know that they share our goal of moving those numbers up. We're glad that they located many of the pharmacies that they opened in those high SBI zip codes. But we need to do more to make sure that people who actually live in those zip codes are getting vaccinated in those pharmacies.
Thank you.
Connecticut Public Media.
Good afternoon. The accelerated rollout, is this leading to older people who still haven't been reached being left even further behind?
No, I wouldn't say that at all. We're doing everything we can in that age group. But as Josh said, we're projecting ahead about another week. We think at that point we'll have gotten most of the 45 and above that are ready to get vaccinated. I don't want to leave any vaccines left on the shelves. That's why we're opening it up beyond. You'll see the older age groups continue to creep up, but it certainly slows over a period of time.
And are you concerned that this new guidance will cause some young, high-risk people to be left out of the accelerated access?
No, it's the exact same logic headed into the next phase that we had previously. It's just because we're getting more vaccine and because our providers, they're doing such a great job, Stanford Hospital and others, getting those shots in arms, that we can just move the whole process forward a few more days.
Thank you.
The Hartford Courant.
Hi. First of all, an easy one. Josh, when you were answering Dave's question a minute ago and you said 57% of those 45 and older, was that 45 to 54 or was that all people 45 and older?
He asked 45 and above.
So that includes everybody all the way up?
Correct. So if you want, your next question is what is the slice? So the 45 to 54 only population is currently at 28%. And when we do the analytics and look at where they're going to be a week from today, they'll be right around that 50% threshold. We're going to be adding about 3% per day between now and then. So that'll get us up to about 50%. And then the 55 to 64 is currently at 57% just for that decile.
Got it. You had said a few days ago that you would have a new SVI target projection today. Do you have that for us?
We do. So as we added the 45 to 54 into the denominator, if you will, into the target that we're searching, it does skew slightly heavier into those SVI zip codes. So the target went from 25% to 26%. And our attainment last week slightly improved as well. So in the prior week, we were 22% against a 25% target. And this past week, we were 24% against a 26% target. So we're narrowing that gap steadily. We're not there yet, and we still have more work to do, but making progress.
Yeah, so I want to ask about vaccine equity more broadly as well, because it's something you guys have talked about a lot, and yet still when you look at the map, you see that Hartford, Bridgeport, New Haven, Waterbury, New Britain are all the way at the bottom of the list in terms of the amount of residents who've been vaccinated. You see kind of lingering disparities in the racial numbers that you put out every week. So I guess what hasn't gone right to result in such extreme and enduring disparities, and what needs to change moving forward to close those disparities?
Sure. Happy to take a first pass at that. I mean, I think first of all, it's important to point out that 50 states are struggling with this challenge, Connecticut among them, and we're working at it as hard as we can. Kathy can talk as well about some of the efforts, she already did, about some of the efforts they're making, but really it is about ensuring that there is access is easily available for everyone who wants a vaccine as possible. That's the $58 million in investments that the governor announced that will build upon very similar activities that have already been going on in many of these communities, bringing vaccine to churches, to community centers. People now are going door to door, doing outbound calling, reserving appointment slots for people. But there's much more that we need to do. And Kathy, would you like to comment on that as well?
Certainly, yeah. I think there are a couple of very important key ingredients in addition to everything that Josh said, working with our community partners to identify in every single neighborhood, in every single group, what are the trusted partners that we can work with to get to those communities and to have those critical conversations about the importance of the vaccine. Then we have to make it easier. That's why we launched the No Barriers event. We have to make sure we have interpreters. You can bring a friend, someone who will help you navigate the healthcare system, which can often be frightening. No appointment necessary. That's why we hold these No Barriers clinics, where they don't have to worry about registering or all the cumbersomeness associated sometimes with accessing the system. Come in, we'll have someone here to help you, we'll interpret for you, we'll support you through that process, make it really easy. And then in addition, we have to go door to door. So actually the grant that we just received from the Cohen Foundation will help us put community health workers out in those communities where we may not be having as an effective a response, to go door to door and get the word out and get them, either bring the vaccine to them or find a way to make those barriers broken down, break down every barrier that's in place.
Jerry, if you're there, If I could just ask Jerry Reyes, talking about trusted advocates and breaking down barriers, what could we be doing better in Waterbury?
I just wanted to comment a little bit on this because the BPRC was enormously important in this conversation of equity and the fact that communities of colors really were left behind on the onset. So I have to say that the larger municipalities, I think, are doing a much better job. I can tell you that in Waterbury, the next steps for us is basically going out, expanding our satellite operations, number one. And number two, we're actually going to have the vans, the mobile vans, ready to go very shortly. What's holding us back right now is just the number of vaccinations. But there's an important point that Ms. Kathleen was talking about. Being able to convince somebody and talk to somebody and explain to somebody about the vaccination in their native tongue, and to bring her neighbor in, his or her neighbor in with them, goes a long way when you're trying to actually explain to people why the vaccination is so important. Local buy-in has been the selling point, if you will, for massive participation in Waterbury. And we are a long way from where we came from as far as percentages of involving the communities of color. There's no question that Waterbury is on the right track, and I won't speak for all the other large municipalities, but I think that if Waterbury is an indicator, the state of Connecticut is on the right track with dealing with communities of colors and equity. And I would also want to just be complimentary one more time. I have been working very closely with Dave Reyes for a long time, long before he was given additional responsibility. And he has been a key liaison long before he's been associated with the Department of Health. And I wanted to make sure that I thanked him for his input and his valuable connections back to the Department of Health, which will be even more valuable as we move forward very aggressively in finishing off the rest of the state.
Thank you.
CT News Junkie.
Thanks, Max. You guys showed a graph earlier of cases per 100,000, and consistently on that graph, our kids aged 10 to 19 were on the top. Given that a lot of schools are going back in, that's probably a source of anxiety for parents. And, a lot of these are, I guess, a chunk of those you can't vaccinate under, the currently approved vaccines. Is that something that worries you, Governor?
Not so much, only, Hugh, because the complications are so minimal in that age group. And we found certainly in the youngest age groups and, school, K through 12, wearing the mask has really dampened down infections less than the general overall community. But, we're talking to Johnson & Johnson and the other guys this past week, and they are working hard. They're getting testing done for, vaccinations as young as that, 1 to 9 age group. And they'll probably have something available by the end of the summer, early fall, in which case everybody would have the option of getting vaccinated at that point, all ages.
Okay. That's all I got. Thank you.
The Waterbury Republican American.
Thanks. I've been dying to ask this question. What's the deal with that red line with Rhode Island? I got a question for Representative Reyes. What are you hearing from folks who say they don't want to get vaccinated? When you go there and you do your outreach, and afterwards they say no, still not going to get one. What are you hearing from those people? And are you hearing a lot?
Paul, that's a great question. And listen, we are not going to be able to convince everybody. I am not a doctor. I can only give them my best reasoning why I myself have already been vaccinated. And as I said earlier, we have used the BPRC as a community of leaders to actually go back into our own communities and advocate for the vaccination for the health of our own families and our surrounding family members. But the truth be told, Paul, there is a small percentage of people that are afraid. And I wanted to share with you that one of the strategies that I've been imploring lately in the greater Waterbury area is really having a sit-down conversation with pastors and actually having the pastors that have been vaccinated, who have been supporting the vaccination, to actually speak to the congregation. And it's been helping a lot, and it's actually getting us some folks turned around. And honestly, it's about education. You're more afraid of what you don't know, and then you're afraid to get a vaccination for something you don't know. It's about education, and it's about simply going out and embracing that community. And it's okay to be afraid. It's okay to be scared of the unknown. But rest assured, we can give you the best answers we can, and hopefully you'll find comfort in the word that's coming from your pastor and from your trusted leaders in the community.
And you gave us some percentages earlier in terms of the vaccination rates. I think it was 51% white, 38% black, and 36% Hispanic. Did DPH give you any figures, percentages on the fully vaccinated percentages?
Paul, I don't have that, but I'm sure Josh can share that with you. That data was shared with us the other night by the Department of Health, and they do have those data.
Okay. Josh, can you tell us how many people have received out of the fully vaccinated have received the Johnson & Johnson shot? I got to ask a Johnson & Johnson question.
I didn't think you'd let us get through one without a Johnson & Johnson question. So we administered just over 40,000 Johnson & Johnson first doses. We've got very few over the last couple of weeks, as I think you're aware. That's going to change next week in a big way.
Okay. And in terms of Stanford Hospital, you were talking about you guys are working on how you're going to identify and prioritize pre-existing conditions. Josh sort of discussed this with us last week. I was just wondering, is this something that hospitals are doing in coordination with one another? It's going to be a sort of a universal practice of hospitals, or is it going to be done on an individual basis?
Well, we'll receive guidance. We already have some information about the diagnoses that are, and it's the ones you would expect, the high risk diagnoses where we saw perhaps during COVID those individuals did not do well, and they would be at risk if they were exposed. And then it'll be around what is the level of attestation or documentation that we need around those conditions. Remember, a lot of these patients are known to us. If you're serving your community, a lot of the individuals who will have the diagnoses that are at risk are probably getting their care with their community or their regional medical center, and they'll be registered with us, and there'll be evidence and data around the fact that they indeed do have that diagnosis. So we're going to have a system to be able to identify those individuals and prioritize them.
Okay, thanks. And Governor, do you have any idea? I know it's May 20th is a while away. Well, not that far away, but do you have an idea of how long it's going to take for the legislature and the governor's office to sort of come to understandings on executive orders and emergency powers going forward?
Well, obviously, COVID will have something to say about that, but I'd like to think if there are any highly objectionable executive orders, legislatures in session, they can speak now. We're going to put in place a package of those that we really think have got to be continued for the foreseeable future. And I think the legislature is going to vote tomorrow whether just to roll it over for one more month and give the legislature more time to go over each of those EOs.
Yeah, I understand. Yeah, that's. But I'm asking, do you think it's going to be closer to May 20th or closer to April? You know, the end of April, that they're going to be in a position, or you guys are going to be in a position to make that call?
Well, Paul, my instinct is we're going to be talking about booster shots and perhaps vaccine for kids at an earlier age. So this may not end on May 20th. This may go on for a little bit longer. There may be flare-ups along the way. That doesn't mean we need broad executive powers, but it may mean we need some flexibility specific to healthcare.
Okay, thanks very much.
The Day of New London.
Hi, Governor. I had another question on the topic of vaccine equity. The ATU, the transit union, came out today with a press release urging you to provide immediate access to the vaccines for transit workers. They were pointing to transit workers, they can't work from home, they transport other essential workers, and also that workers and riders are disproportionately people of color, who I know you're really focused on in terms of vaccine equity. So I was just wondering if you have a response to this request from them.
The good news is that everybody over 45 is available now. Everybody will be available within 1 week.
And then another question on the $58 million. Was that done at all was deciding how to allocate that for vaccine equity and distribution done at all in consultation with legislators? And also, how are you identifying where the money is going or which communities are getting how much?
Well, I think Deirdre Gifford and Public Health has led our outreach effort, doing everything we can, working with the local departments of public health. What can we do with those not-for-profits that Kathy was talking about? How to make sure that they have the resources they need to knock on doors, get people here. That's been the focus, but we're connected with legislature all along the way.
I think I'll add, Governor, it's great to have the chairman of the Black and Puerto Rican Caucus on, who has greatly helped informed the administration on our equity efforts, as he talked about earlier in this press conference. We're going to continue to work with all the individuals within the legislature and the communities as it deals with all of our various outreach plans. And I know that we have continual meetings with the Black Puerto Rican Caucus, as well as other members of the legislature, as we start rolling these plans out further. But they're greatly informing us, telling us where the hotspots are, who are the individuals we should be partnering with, and the community individuals and organizations we should be partnering with. So we thank them for their leadership and their support.
And then one last question. I know, we see these statistics come out on hospitalizations, deaths, case positivity, but that doesn't really capture what we're hearing about long COVID, people who tested positive months ago but are still seeing lots of side effects, some fairly severe months later. So I was wondering, in Connecticut, both, are there metrics that you're tracking or following somehow on long COVID? And also, are there, research programs in Connecticut, examining this and looking into kind of causes and treatments?
Kathy, do you want to start with that?
Yeah, we're not tracking specifically every single COVID patient for what the lingering effects are, but we are for sure seeing lingering effects in terms of pulmonary status, heart disease, other things that are, and exhaustion and psychological stress associated with having been a victim of COVID. And really what I think is important is that these individuals have healthcare needs that need to be addressed by the physicians and the staff that are caring for them. And so making sure that people get back into care and that they are addressing those programs. There is research occurring across the nation and in our own state around how to best effectively treat those individuals and what kinds of services they need. And we're working, just like every other healthcare organization, to wrap those services around those patients. We've established a program, as have others, for what we're calling the long haulers, those who have had COVID and are really struggling with their recovery and have lasting sequelae associated with it. So they get assessed and then they get the resources that they need to address all of those lingering needs. I don't have numbers around those. I don't know if that's being tracked, but it's being tracked in just the incidence of their continued acuity as it relates to the comorbidities associated with the lingering disease.
Thank you.
To add on that, if I could, Erica, we have about 14, 16 months of experience with COVID, and we have no idea what these long-term effects could be. So I do take some exception to those that say, don't worry, it doesn't really impact young people, let it rip, let it go through the system. If they don't end up in a hospital, you don't have to worry about that. I think that's really fooling with fate, and that's why we've made a priority of getting everybody vaccinated, keep down the infection rate as best we can, because we don't know the long-term consequences.
We have one final question from the Waterbury Republican American.
Thanks, Max. Hey, Governor, I wanted to ask you, House Republican leader Vin Candelora took exception this afternoon to a remark you made regarding, Republicans and NASCAR drivers and vaccination. I just wanted to see if you had an opportunity to respond.
I was just having a little fun, get a sense of humor. Let me just say, I think you got a sense of, from Josh and our Department of Public Health and the work we have trying to manage the vaccines and get them distributed. I think you see from Jerry Reyes, one of the trusted advocates, people who can talk to the community, get vaccinated in public, work with the community to make those who are a little more reluctant to get vaccinated, make it easier for them to get vaccinated. And these trusted advocates are going to be more and more important as we move through the next few months. And Kathy Szilard over at Stanford Hospital, thank you. You're the ones actually getting the jabs in the arm and making it happen. And you can talk about the amazing sense of relief people have once they're vaccinated. Thank you, everybody.
Pure joy.